My name is Milen Jacob and welcome to my OET Prep Talks. Today I'm going to talk about a question or a concern that a lot of OET test takers have, and maybe you have the same question. What to call the patient or the carer? Now honestly, it's not a major problem, it's not a major concern, but since that could be bugging you, I'll demystify this aspect of OET speaking. There are a number of things that can be done. Firstly, you can use the name of the interlocutor that they tell you when they introduce themselves. That's perfectly fine. So if the interlocutor tells you his or her name, that exact name can be used for the patient or the carer. That's fine. But if you're not comfortable with that, there's another option. During 3 minutes preparation time, you can ask the interlocutor what you should call the patient or the carer. That's fine as well, perfectly fine. Or you can give a name to the patient or the carer. So you can address like, hello Tom, that's fine as well, right? And when you analyze the role play card, if you feel that or it gives hint, particularly from the background information and the setting, that this is a familiar patient, you have seen this patient before, it's always advisable to have a name beforehand rather than asking their name. That's not a good idea because this is a familiar patient, so you must be knowing the name of the patient, right? So that can be a review visit, or the patient has been admitted for a few days and you go to the patient's bedside, that's fine. But you should know the name, you don't have to ask the name. But if the patient is a new patient who walks in to the clinic, to the GP surgery, the outpatients department, then in that setting, this is going to be a new patient or a new carer or parent. So there's no, it may not be possible that you have met them before, so you can ask their name. Would you mind telling me your first name and surname or something like that? That's perfectly fine as well. So analyze the case note and try to identify, the role play, and try to identify whether this is going to be a familiar patient, a patient you have met before, could be some time ago, a few weeks ago, or maybe a few hours ago, could have been under your care for a longer period of time, like a few days, as in the case of someone who is admitted. So that's fine. Or is this a new patient visiting you, walking into your clinic? So depending on that, you can have a name prefixed, or you can ask their name, but do it naturally. Look at or think, what would you do at workplace if you are seeing a patient who is in the ward? Then you will never ever go and ask their name. It may look weird. So do what you do naturally. But if you have a walk-in patient, a new patient, then you will definitely have the introductions. And that can also be part of building rapport with the patient, so that's perfectly fine. So if you're confused about it, think, what would I do at work? In a hospital or a clinical setting, do the same thing. It doesn't matter. There are no fixed rules. Be natural, and that's what OET wants you to do. Thank you.